Hello, my name is Konstanze Döhner. I'm a hematologist working at the University Hospital in Ulm, Germany, and I'm a member of the executive board at EHA. And I'm very happy that I can discuss today with my colleagues about EHA's activities and the war in Ukraine.
Hello, I'm Elizabeth Macintyre. I'm current EHA president. I work as a diagnostic hematologist at Université de Cité in Paris, France. I've had great fun being president for over a year now, and it's come with all sorts of unexpected adventures, and I'm delighted to be here to talk about how we reacted to the Ukraine crisis.
And I'm Nathalie van Havre. I'm the head of education at EHA, and I've been involved in EHA's activities to support Ukraine from the beginning, and I'm also very happy to be there to share what we've been doing.
So EHA was very quick to react to Ukraine invasion in February 24. So could you please summarize EHA's action in favor of Ukraine and the Ukrainian hematological community?
Of course. So EHA, the first thing EHA did was to place on the EHA website a joint statement by EHA and also most of the European national societies committing to support Ukraine in all possible manners and support Ukrainian hematologists and patients. So that was the first thing. But we didn't stop there. We immediately made a significant donation to Médecins Sans Frontières, who were one of the first organizations to be present in Ukraine, delivering medication, helping people. And this was really a general donation to help everyone. It wasn't targeted specifically to hematology. Then we started working with the Lymphoma Coalition. The Lymphoma Coalition is a patient organization who had been involved very early on in Ukraine, creating lists of patients who needed care and were in the country. They were working then at the time on all, and are still working on all disease areas, not just lymphoma, and also including some oncology, solid tumor patients. And so we had a growing list of hundreds of patients in Ukraine. And EHA worked with volunteers to create a website that included a data set on patients, so their needs, the specific conditions, the care they needed, the specific treatment they needed. And then at the same time, another side of the website was European hospitals and the care they could provide. And the idea was to have a match of patients and hospital to provide, the best care possible. For this, as I said, we worked with volunteers who created the website, and then we also funded 2 positions to support the website and support the Lymphoma Coalition. And these 2 positions were filled by Ukrainian refugees in Europe. We also provided, we worked with a company called Ziver to provide GDPR and patient confidentiality file transfer to anyone involved in the process, because of course, even if we're talking about an event like war, we still need to maintain, confidentiality. Then, once we had established that, the most urgent thing was to move patients, and we started using or funding a non-governmental organization called Helping to Leave. Helping to Leave moves people out of Ukraine, not just patients. They move everyone, they support the move, they provide transport, they provide psychological care, they provide shelter, food. But they have a medical division, and specifically a hematology-oncology division that concentrated on the transport of hematological patients. So Helping to Leave has been able to transfer patients and their families, so it could be their children, their loved ones, to other European countries for them to get the care they needed. Many of those patients went to Italy. That was the first country that we that was receiving patients, but then it extended to other countries as well. And then eventually, once many of these patients completed their treatment, and for those who wanted to, we also helped with return to Ukraine, because some of those people do have still family in Ukraine or family members fighting, and they want to be close to them. So we felt that we had a duty to make sure that we do what was best for them. So this is still continuing with helping to leave.
So Nathalie, maybe you can briefly explain what have been the major difficulties and challenges in the implementation of such a huge program.
I would say that the main difficulty is the changing picture every day. Since the beginning, you plan an evacuation of patient, but you plan a route, but then there's a bombing. And so, the transport that was supposed to go this way cannot go this way, it has to go that way. All the support that you had put in place along the way cannot happen, it has to be changed. So that was one difficulty. The other difficulty was the transport of patients who were unwell. Those who can travel sitting in a bus, well, that's relatively easy. But we, Helping to Leave, often had to organize at the last minute the transport of patients who had to be lying down with a nursing escort. And that's quite challenging because it's not like driving on a motorway, it's quite difficult. So that was hard. The other thing was to secure accommodation for patients and their families at their destination. It's all good to have a place for a patient in a hospital, but not everyone requires inpatient care. A lot of people obviously can do fine with outpatient care, and they need to have a place to stay. And more than a place to stay, it has to be a decent place, for their families. We supported children by giving them laptops so they can continue distance education, all the kind of things that are essential to life, whether you're in your own country or not.
And do we also implement in our program to follow up what happens to these patients if they have already been gone home back to Ukraine, or if they're still in one of the countries?
Yes, well, that's the beauty of having the website that we created, is that we're able to know exactly what is going on, and also continue to work on growing the list, because it doesn't stop, right? There's always new diagnoses being made, and we need to keep working.
So Elizabeth, one question to you. What do you think should be the role of a medical organization like EHA in crisis situations like this inside and outside Europe?
I think it's been a learning process for all of us to suddenly gear up to what was required, and also to find the best way of being useful, because so many people want to help, so many organizations want to help, and that can all get a little bit chaotic, and you realize why you need military organization in times of crisis. I think, as Nathalie mentioned, we were very lucky in that the Lymphoma Coalition, one of their main representatives, Natasha Bolaños, is also part of our patient advisory committee. So there was natural links, but it did require a fair amount of cooperation between the different organizations, between the general cancer organizations. We more specifically concentrated on patients, obviously, with hematological malignancies. And just at a slightly more political level, the COVID crisis led to the creation of HERA, the Health Emergency Response Agency in the European Commission. And along came Ukraine just after COVID. And obviously people were saying, should HERA also be facing up to Ukraine, which I think was very premature at that point. So it's much more a question of how can everybody try to complement each other without all of us doing the same thing, and then there being huge holes in what's required. And I really take my hat off to our hematology colleagues in Ukraine. The doctors have been available under difficult circumstances, and I think, like their leader, have shown an incredible calmness, determination, and they've been able to talk to us in a constructive fashion. And I think it's been a lesson to a lot of us in Europe and just how people can show what they're worth in times of great crisis. I also think it's been very positive for our contacts with the national societies, because many of them realised that we could face this together, and it made more sense to face it as European hematology while building on the internal strengths in each of the national societies.
So this is really a great program, and this is still ongoing, and we do not know how long we need to have such programs. So the question is, has EHA other actions planned to help Ukrainian medical community and hematologic patients?
Well, yes, I think in keeping with what I said, and as Nathalie mentioned, we early on ring-fenced a budget for supporting Ukraine. But since we weren't sure how best to use it, we decided to use it as we saw appropriate. So we started with Médecins Sans Frontières, and then we went on to the different activities that Nathalie mentioned. We're putting the final touches to a program to help hematologists, whether they be medical or scientific, who have left the country, to maybe have some useful, constructive, professional activity. Obviously, the doctors can't actually practice, but maybe we can find, we're opening up grants for Ukrainians outside of Ukraine at the moment who would like to have some kind of professional insertion until they can return to their country, so that hopefully when they do manage to go back home, they'll come back with something useful from Europe. We don't have the final details yet, but they should be straightened out in the very near future. And so we're keeping up our sleeve other opportunities. I think the other thing, because we are very keen on encouraging return to normal as soon as that's possible, so we are also thinking about ways to contribute to reconstruction of Ukraine once it becomes possible, which we hope will be in the very near future.
Yeah, and I think there are still ideas coming up how we can help and support Ukrainian. It's depending on the future, it's depending what is going on. But I think we have lots of ideas, and we have initiated all these activities, and we have the network now, which is working quite nicely. So I think our support will be for sure there whenever it's needed.
We certainly hope it continues to be that way.